When I decided to accept the job as a nanny for a boy, one thing many people told me was to always be careful when changing his diaper. Their advice was to always have a wipe or washcloth on hand to cover him up while changing his diaper just in case he decides to go in the middle of the change. Having always babysat for girls and feeling very well versed in the diaper changing arena, I figured I had this thing down and I didn't need anything to cover him up. I could change a diaper in seconds, so why waste a washcloth or wipe for that? A couple of weeks after taking care of this little boy, I was getting good at the diaper changing thing. I didn't use anything to cover him up, I just always had the goal in mind to do it as quickly as possible to avoid an accident. Well, apparently, I didn't need to get too confident in my skills because it didn't take long before we had our first mishap. He was only a few months old and I was in the middle of changing his diaper. I must have done it a bit too soon because as soon as I pulled off that diaper, I had a nice wet mark all over my shirt. It was then that I officially welcomed myself to the Changing Boys Club. According to dictionary.com, a diaper defines as a piece of toweling or other absorbent material wrapped around a baby's bottom in between its legs to absorb and retain urine and feces. According to Statista.com, the global disposable diapers industry was valued at approximately $64.4 billion in the year of 2014. Over 92% of all single-use diapers end up in a landfill. On average, 6,000 plus diapers are used for one child. Disposable diapers cost about $62.50 per month, $750 per year, and $1,500 over the full time a child is in diapers. When changing a diaper, you need, of course, diapers, wipes, diaper rash cream, a pacifier to soothe the baby, a changing table or pad, a trash can to dispose of the diaper, hand sanitizers or other cleaners, and of course a baby. Before bringing the child to the diaper changing area, perform hand hygiene and bring the supplies to the diaper changing area. All the supplies are here, so we're just going to set out the pad for the baby to lay on. Next, lay your baby on his back. And then remove any clothing that inhibits access to the diaper. So you remove all the buttons, take his legs out. This onesie makes easy access for the diaper because you don't have to take off the entire outfit. You can just move it enough to where you can get to the diaper. Next, you remove the soiled diaper. To remove, you pull up the sticky tabs, and you lift your baby up gently, but just enough so you can scoot the diaper out from underneath his bottom. Next, you will wrap the diaper up to where it closes on both sides, and you can throw away the soiled diaper. Next, you use your wipes to clean the baby's bottom. You always go from the top to the bottom to avoid infection, especially for girls. You can dispose of those as well. If the area is red or inflamed, it is recommended to use diaper rash cream. You rub that on. Then you wait for the baby's area to dry before placing a new diaper on. Then, after it's dry, take a fresh diaper. Be sure that you're putting it on the right way. You place it underneath the baby. Bring the front part up. And you replace and fasten the tabs to secure the diaper on his or her waist. Next, you replace the clothing back onto the child. And fasten the buttons. Clothing is back on. Lastly, you will once again clean your hands. It doesn't have to be hand sanitizer, you can always just wash them in the sink. Either way is effective. And use baby wipes or other cleaners to clean the infected area or anything that may have been affected. The pacifier isn't a necessary object, it's just if the baby is upset, you can put it in their mouth to soothe them out doing the diaper change. I have shown you how to properly change disposable diapers. The materials are easily found, however, they can be quite expensive. As you can see, anyone can learn the steps of how to properly change a baby's diaper. I hope you have enjoyed this presentation and now have confidence in your ability to change diapers. Thank you.